Those of you joining us through other media outlets, members of the media, I am Sherry Ann Noel, your host for this morning's press briefing. This morning's press briefing is being facilitated by the Ministry of Health, and on the head table to my immediate left we have Mrs. Maria Primus Joseph. She is the Director of Hospital Services. Next to her we have Honorable Philip Telesford, our Minister for Health, and Dr. Sean Charles, Chief Medical Officer. We will begin this morning's press conference with a presentation from the Honorable Philip Telesford, and that presentation will set the tone for what's to come. After that, we're going to get an update from the Ministry ongoing primary health care initiatives. That's by CMO Dr. Charles, followed by updates and presentations by our hospital director, Mrs. Primus Joseph. Once all of the members of the head table makes the presentation, we will then open up the floor for questions from the media. I would just like to inform members of the media now that we will take 2 questions each, and for the first round, and after that we will come back again if you have any further questions. So without any further ado, I now introduce to the microphone Honorable Philip Telesford, our Minister of Health, who will make a presentation. And as I said in the introductory remarks, that presentation will set the tone for what's to come during this press conference. Minister Telesford.
Thank you. Thank you very much, Ms. Noel. Good morning to all of Grenada at home and in the diaspora. It is a privilege and also a pleasure for me to be able to provide an update to the nation, having completed the first 6 months of 2025. Our work in 2025 is driven by our work plan, which we carefully crafted to be able to execute our functions as a ministry. And it is captured under the theme, Achieving People-Centered Integrated Care in Grenada. And that's our focus for 2025. At the heart of this approach is primary health care, which serves as the backbone of people-centered care. This concept goes beyond the traditional idea of patient-centered care, recognizing that our patients are more than just the illnesses and the medication. They are individuals with complex lives, social contexts, and economic realities. So we bear all of these things in mind. Primary healthcare providers often have long-term relationships with those that they serve. They understand not only their medical conditions, but also the broader challenges such as divorce, job losses, social isolation that impact health and well-being of our people. Primary healthcare has long embraced this holistic model of care, and the ministry affirms its vital role in a strong and resilient health system. The key priorities for our ministry in 2025, as per our work plan, are structured around 6 main pillars: leadership and governance, health service delivery, health system financing, human resources for health, pharmaceuticals and medical technology, and health information system. I will treat with some of these this morning. These pillars provide a strategic framework for targeted action, integrated service delivery, and sustainable improvement in the health and well-being of our population. I'll just share with you some of the major initiatives that were undertaken. 1, resumption of fluoride treatment in primary school commencing September 2025. So that is to be undertaken, in 2025. All of the elements for the execution of that program has already been done. Integration of the HIV/AIDS into primary healthcare to improve access and equity and strengthen the continuity of care. That, again, is very important. For those of us who do not know, AIDS and HIV has been on the rise, so we have to continue to work towards curbing this illness. Increased DMO coverage at medical stations. We continue to work and employ our DMOs as we have them qualified in the system. Weekly workplace visits and media outreach to promote men's health awareness named Blue Fridays. And we've done some of that and we continue to work in that regard. We believe that we must work closer with our men to tackle illnesses, especially prostate cancer and other diseases that affect our men. So we continue to lobby, we continue to foster greater relationships with our men to ensure that together we are able to tackle these illnesses. First ever perinatal conference to review national statistics, identify trends, and share strategies to reduce perinatal death and complications. This was organized by the medical services at the General Hospital. World Kidney Day awareness that happened on March 13th. Again, kidney failure and kidney diseases, has been something that has been on the rise in Grenada, and we know how costly it is, so we continue to screen and encourage early screening. We continue to work with the population to ensure that we're well educated to be able to treat with these illnesses. Infrastructural upgrades undertaken and other planned for several health facilities across Grenada, Carriacou, and Petit Martinique. In addition, several wards at the General Hospital are scheduled for renovation to improve service delivery and patient care. The Hearts Initiative that was launched, and this is a global initiative which is led by the World Health Organization, aimed at improving the prevention and control of cardiovascular diseases. So establishing, equipping, and furnishing of the Health Emergency Operations Center at the Ministry of Health. Again, that is a very pivotal one for our health system, so that as a unit, we can communicate across the board effectively, especially in the event of emergency. So we have our system now set up at the Ministry of Health that with our control system or radio system that is hooked up at strategic locations, including the ambulances, to be able to respond in the case of emergencies. So we have our system, hurricanes and other natural disasters too. We have our robust system, so we don't necessarily have to depend on the cell phone, but a robust system that can reach our health professionals if and when needed. So that has been set up, and I believe this one is pivotal for our emergency responses. Cancer registry, that is a work in progress, and we believe that will be launched very soon. Onboarding of private reporting sites to the DHIS2 system. Let me break it down a bit. Digital health information system. So what we're doing is connecting our private healthcare providers to the Ministry of Health's digital health information system, so that we can share information across the public and private sector. So that is the onboarding of that is currently happening. So private healthcare providers are being onboarded to the DHIS2 system for weekly disease reporting and improving comprehensive and accuracy of comprehensiveness and accuracy of national disease surveillance data. Surveillance is very important for us to be able to monitor what is happening around us as far as the spread of communicable diseases are concerned. Other key achievements. Well, as you're well aware, we have the Mount Sinai who is working along with the Ministry of Health, and so we've been able to achieve some milestone. with them. Increased cancer literacy was made possible through the United Unique Initiative. So that has happened. Fit to Teach is a program developed by the Health Information Department within the Ministry of Health, where we go into the schools, we educate our teachers on how to respond to illnesses, how to respond to situations, how to respond when something goes wrong with the children. So we teach our teachers how to teach our children, including how to eat properly. What are the essential foods, reducing fatty stuff, reducing sugar intakes, and all of that. So it's a comprehensive educational system that we employ so that we can teach our teachers to teach our children. As you know, education is one of the first pillar in building a strong and resilient health system. The e-health steering committee has been established to chart the course for digitization of healthcare. So that committee is currently working, and we are covering some grounds as far as that is concerned. The introduction of 2 new vaccines, the rotavirus vaccine that treats mainly with diarrhea in infants, and the pneumococcal vaccine which treats with pneumonia in infants. So that has been introduced during the month of April. We successfully hosted Continuing Promise 2025 just a few weeks ago. That's a medical mission, along with several other specialist missions that we accommodated during the year. We wish to thank all of our partners. I don't want to start naming them, but quite a few partners, and also visiting missions. Those who come under the hospital system, as well as those who come privately. We thank all for their service to our beautiful island. Commissioning of a brand new central kitchen after years of operating under suboptimal conditions, including outdated equipment and deteriorating infrastructure. As a matter of fact, the kitchen became dangerous after a period of time. We were able now to move into the new kitchen, and so that was commissioned a few months ago. The ICD-11 cause of death model successfully integrated into the DHIS2 system, allowing for standardized, efficient mortality reporting. Additionally, 2 containers of medical equipment and furniture procured for improving service delivery. X-ray machine has been received and will be commissioned in Carriacou. That's at the Princess Royal Hospital at Carriacou. The onboarding of the statutorization committee, as you are aware, we continue to work with statutorizing the hospital to make it a little more organized and be able to be much more responsive. So we're trying to statutorize the hospital. We've onboarded the team, and a lot of work is being put into that as we speak. Additionally, we are looking at national health insurance, and so both of these will go hand in hand, and hopefully within the next 18 to 24 months, we should be able to be in a position to enjoy the benefits of statutorization, and also, if not ready for NHI, be close enough to be able to report on that. Upcoming priorities, next 6 months. We expect to roll out the Health Information System Phase 2 over the next 6 months. Implementation of childhood obesity policy, implementation of infrastructural upgrades at select health centers. A number of them are done for upgrades, and that will happen. The process is well advanced, and so we expect to see a lot of that happening in the not too distant future. World Patient Safety Day observance, that's going to happen. Continued regularization of health care employees. That is one, as we spoke earlier, it is essential that we consider the human element of healthcare. As a matter of fact, the healthcare professionals are the single most important ingredient in providing healthcare, and that is why we continue to work to ensure that all of our people are regularized in one form or the other. Continued research and analysis towards the development of national health insurance, as I spoke to a little earlier. Conclusion: the Ministry of Health remains steadfast in its commitment to strengthening the health sector and advancing the well-being of Grenadians through continued investment in primary healthcare infrastructure, workforce development, and policy innovation. We aim to build a more resilient, inclusive, people-centered healthcare system. As we pursue these goals, we acknowledge the critical role of the Cabinet in enabling progress through its strategic guidance and policy endorsement. So we want to thank you so much for your support. We thank the Prime Minister and the rest of Cabinet for allowing us this noble opportunity to transform healthcare in Grenada. Thank you.
Thank you very much, Honourable Minister, for that thorough overview on programs, priorities, and projects within the Ministry of Health over the past 6 months. And Minister would have mentioned, very importantly, coming up in September of 2025, in the start of the new school term, the fluoride program. He also mentioned the fact that they have seen an increase in HIV, parental conference, the outcome, the infrastructural updates in terms of what they're doing to existing facilities, new facilities. Very important as well mentioned is the health emergency communication system, the digital health information system, and the Mount Sinai relationship. And he also spoke to the commissioning of the central kitchen at the General Hospital, the statutorization of the hospital, and one of the top upcoming priorities would be the regularization of health workers. So that's a lot for us to think about. So as I mentioned earlier, members of the media, we will link with you after we've completed the full round here of the panel. At this time, I want to invite Dr. Sean Charles, the Chief Medical Officer, to make his presentation. Dr. Charles.
Good morning to Minister, other members of the panel, to our viewing and listening audience and members of the press. I'm happy to be here to accompany the team to discuss, matters that are of importance to the healthcare of our nation. Now, I must say that it should be remembered that the most important thing, or the most important element to remember as it relates to healthcare, is what happens before the engagement with the health systems. And in our setting, our main priority, firstly, is disease prevention. All right, first is disease prevention. Then we have early identification for persons who have risk factors. And then all the other elements, such as diagnosis and treatment and rehabilitation, come after. Now, in bearing this in mind, our top priority as a Ministry of Health, firstly, surrounds disease prevention. Hence the reason primary health care is of heightened importance to us. Now, I'll just mention a few of the primary healthcare initiatives that we have embarked on over the year. Now, Minister has, in his overview, touched on quite a few of them, but as you would appreciate, it is one Ministry of Health functioning harmoniously, and all our programs are meant to be synergistic and to work together. Now, one of the first initiatives that we undertook, bearing in mind the current, as we say, the epidemiological situation or the types of conditions that affect our population, chronic diseases was recognized as the leading cause of morbidity and mortality. And to combat this, to address this, our ministry has placed emphasis on introducing evidence-based interventions. And the WHO Hearts Initiative is one such evidence-based intervention. And in evidence-based, we mean interventions that are proven to be effective. This initiative was launched earlier this year, and it focuses on addressing the risk factors for cardiovascular disease. So it treats high blood pressures and cardiovascular disease. Now, we see this as a very important intervention in order to address this significant challenges, because I'm certain that we are all aware that high blood pressure is quite prevalent in Grenada. About a third of our population, more or less, is walking around with elevated blood pressures, and many individuals are unawares. Whatever interventions we introduce, they have to be scientifically proven effective, so that we do not waste resources unnecessarily. So, introduction of evidence-based interventions is one of our key priorities. We started with high blood pressure and cardiovascular disease, and it is our intention to move on in the coming months to introduce hearts for diabetes. Secondly, recognizing that there is high demand for services, in particular medical consultation services in our various communities. We have responded by increasing the number of personnel available to provide these services to the population. So many may be aware that we started this drive in the St. George's Health Center with increasing the number of physicians there and increasing the number of hours of services that they offer. And we later extended to St. George South. So in Grand Anse, we have increased the number of physicians and the number of hours of services available. We went on to St. John, where we did the same, then St. Patrick, and most recently, we did the same in St. David. Many of the clinics in St. David's, especially those where the demand is quite high, now have more than one clinic days allotted. So the population is provided with more access, as they say, or more time to visit their clinic and consult with their physician to address whatever health concerns that they may have. At the same time, many patients would recognize that in our clinics you may see a sign with a QR code. All right. Now, we recognize that feedback from the public is important, and this QR code links you to a survey that allows you to rate your services and make suggestions for improvement. So, if patients have not seen this before, we encourage you to look for the QR code. Do the survey, give your feedback to allow us to make improvements to the system. Now, there's another important initiative that we are embarking on, and that is the creation of an integrated primary healthcare manual. Now, this manual will link all our evidence-based protocols and procedures that govern the system, all right, that govern the primary health care services. This is in an effort to standardize care, just like the introduction of evidence-based protocols. The creation of this manual is in an effort to standardize the care that you would receive right across the system, so that there will be no differences in one clinic to the other. And the intention is that everyone uses the evidence-based approach. Now, there are also some other important initiatives, because of course we will look at our health system addresses all phases of the life course. So an important program that we have is the school health program. This screens students in grade 1 of primary school and Form 1 of secondary school. The intent is to identify issues that can affect the learning and the development of the child, and to intervene at an early enough time to allow the child to experience normal, and so at least to ensure that health issues are not, an additional challenge that the child would have to be battling with in school. Now, of course, a number of facilities are up for upgrades. We have the Sotels Health Center, we have this St. David's Health Center under the OECS Regional Health Project, which is a World Bank funded project. And these repairs are to start soon. And as a result, there will be some disruptions, all right? The Ministry of Health is in the process of engaging with the communities and identifying alternate locations where those clinics will be placed. But, some disruptions are to be expected, because as everyone would imagine, after some time, facilities need upgrading and repairs and so on. Now, there are other facilities done for repairs by Government of Grenada, such as Pedmota and Cranbra and Tivoli. All of these are also up for attention. Now, there are other areas, because the Ministry of Health is quite vast. In the pharmacy area, of course, we are constantly making efforts to improve and to become more efficient in terms of our procurement and management of our stocks. And this is an ongoing process between the pharmacy department and our central medical stores. And this is to ensure that we do not suffer from prolonged stockouts or anything of that nature. Part of it has to do with the technology that we use to manage our stocks, which we are addressing. We actively need to seek out updated electronic, management system for our inventory. But there are other efforts. We're also looking at addressing the remuneration that is paid to our pharmacists, because we don't have the number of pharmacists that we would like to have to ensure that we can provide all of the services that the public needs. All right, so presently we are down. We are looking at ways to attract more pharmacists into the system by addressing remuneration and other issues, and the working conditions on all of those. All right, these are currently in process. Now, another significant program, our civil registry. Many persons may not be aware, but the civil registry, or what we know locally as births and deaths, is also a department under the Ministry of Health. You would be aware that currently to apply for a birth certificate, you must go to the office and fill in the paper forms, and you will receive a handwritten certificate. I will inform you that under government's DG4R, which is Digital Governance for Resilience program, the operations of the civil registry or the births and deaths are being transformed. All right, a firm was hired to build an IT platform that will manage all of the processes of the births and deaths department, which means that soon the application for all of your civil registry documents will be digital. It would be online, and your certificates will no longer be handwritten, but will be digital. These are developments that are just on the horizon. That consultancy to develop the project, to develop the platform, ends actually this month, and they are moving into the phase of user testing. In terms of dentistry is another important arm of the Ministry of Health, and we have made significant strides there. Purchasing of equipment, all right, purchasing of new dental units, increasing access to services in our communities, and introducing services that previously we did not have, because previously we only offered extraction, cleaning and extraction. Now restorative services are also being offered. And after many years of absence, there are now dental services at the Guab Health Center. All right, it's once a week presently, but it is now being the number of days is now being is being increased to twice weekly, and we continue to work to improve. The Environmental Health Division is another important arm of health. This is the department that handles a vast number of programs, from vector control to food handling to cemetery management, inspection of businesses that sell foods and so on. They do air quality assessments, port health surveillance, meat inspections. So this is quite a vast. This is a department with quite a vast number of responsibilities, and they continue to work to ensure that order is maintained. Most recently, they've introduced some campaigns to deal with the constant nuisance that we have with mosquitoes, etc. I will pause there. Like I said, the Ministry of Health is quite a large entity, and we have many activities on many fronts, and these are just a sampling of them. Thank you.
Thank you very much, Dr. Sean Charles. Just to recap some of the main pointers, he mentioned that the Ministry of Health, one of the main priorities, disease prevention. He also spoke a lot to primary health care and its heightened importance to the ministry, the increase in personnel at clinics across the country, which creates greater access, creation of integrated primary health care manual, which is extremely important, the school health program. He also spoke to facilities that are down for upgrade and selection of alternative locations, and one person should expect a bit of disruption in services once these projects come on stream. Importantly, so mentioned as well is the civil registry update. Dentistry, they've purchased new equipment, and they've also increased dental services and the return of dental services at the Guelph Health Center. So those are some of the pointers made by Dr. Sean Charles, our Chief Medical Officer. We now move over to the Director of Hospital Services, Mrs. Primus Joseph.
Bless and good morning to everyone. Good morning to the head table and to the listening audience. As it relates to hospital services, I would like to highlight a few things. Strengthening of hospital services through the Mount Sinai Partnership. Currently, we are working on work streams such as governance, where we are looking at training in the root cause analysis and peer review. The organizational culture, where every morning we will have huddles, which have been implemented across hospitals. Quality and safety, implementation of plan for training of staff in life support and defibrillation use. Operations, we're looking at the reorganization of medical records and improving our inventory management on the wards. Infection prevention and control, we're looking at the revision and updating of existing IPC manual and retraining in proper hand hygiene. And clinically, we are looking at the revision and creation of protocols to guide the care of the pregnant woman and retraining in neonatal resuscitation program. Under human resource and health, this continues to be a challenge despite new hires throughout the health sector, including areas of nursing and medicine. We continue to have gaps. This year, in terms of improving our provision of specialist care, we employed an orthopedic surgeon and 2 general surgeons, of which 2 are our own local Grenadians, who returned from studies, as well as an additional oncologist. Our government signed an MOU with Nigeria to assist in filling our specialist gap areas. I want to take this opportunity to engage and to encourage young people to consider careers in various areas of the health industry. Under pharmacy and central medical stores, our CMO has touched on that, so I would go ahead. Laboratory services. The lab continues to work towards accreditation to ensure acceptable and reliable blood results. This process is continuous, and we aim to do some infrastructural work is ongoing in the new laboratory facility to accommodate the transition to the new space. New equipment has already been purchased and is awaiting installation on completion of the works. In the meantime, some tests are limited to patients only. This is because we are currently using a machine that has limited capacity. Over the last 2 weeks, we had some issues with power regards to the hospital generator. Our generator is recently serviced to correct a malfunction issue, and plans are in place for its continuous maintenance. I would like to take this opportunity to thank all stakeholders for assisting in this process and to the public for your understanding during this time. As it relates to diagnostic services, a pilot project has been conducted on the extension of outpatient services such as X-ray and ultrasound. So before we had it to 8 to 4, now we extend it to 6 p.m. in Princess Alice and General Hospital. The official announcement will be made as once the project is completed. So based on the pilot and what we find is we will extend this service and we will inform the public. Princess Royal Hospital will be installing a new X-ray machine between the 30th of July to the 8th of August. And training of staff will also coincidence with the installation. This donation was made by the IAEA, the International Atomic Energy Agency, post-Hurricane Beryl. We would like to thank our government for being instrumental in securing this donation. We know when we call the emergency department, we have challenges because right now we use nurses to respond to emergencies via the ambulances. I'm pleased to announce that we are looking to upgrade our emergency response team, and consultation was held, and a submission is being prepared for consideration to the Cabinet for the implementation of the EMS services. A bit on cancer registry. Our epidemiology unit recently made live our cancer registry. This is critical in collecting data related to cancers, which is a leading cause of mortality in Grenada. The data collected will be critical in guiding overall cancer prevention and care in Grenada. A bit on some infrastructural work as it relates to hospital services. We recently commissioned a new hospital kitchen, And there are many contracts around the way for several projects, including the refurbishment of the acute psychiatric unit, also known as Radun. They should commence in September. And we have the intensive care unit, which will be under refurbishment under the OECS Regional Health Project along with the acute psychiatric unit. So both projects will commence in September. Private block. The on-call lounge and wards will be refurbished as part of the hospital infrastructure improvement plan. And we started some painting of the external of the hospital. Expanded care access to medical missions. We are excited to report on several impactful medical missions and that enhance access to care to our patients. These missions were made possible through the collaboration of valued partners, including St. George's University, the McKinney Foundation, Dr. Jonathan Cosin, who is a oncologist. He deals with the cancers relating to women cancers. The Association of Jamaican and American Humanitarians, the World Pediatrics, CHORS, National Medical Association based in the U.S., the U.S. Navy Hospital Ship, USN Comfort. Together, these organizations delivered a wide range of services for both adults and children, addressing critical gaps in our healthcare system valued at millions of EC dollars. From general medical assessment to surgical interventions, we remain deeply grateful for the ongoing support and commitment to the health of our nation. Thank you.
Thank you very much. That was Mrs. Primus Joseph, the Director of Hospital Services. And just before we open up for members of the media, just to recap, she made a mention of the fact that the reorganization of medical wards, the human resource improvement, the MOU with Nigeria to provide specialist care. She gave us an update on plans for the laboratory, the hospital generator, the diagnostic services, and plans for extension, and very importantly, so the mention of the installation of the X-ray machine at the Princess Royal Hospital by month end, and what the hospital plans to do to address the issue of emergency with the emergency department. Some of the issues there, she gave us the fact that there is an update on the cancer registry and the refurbishment of Radun to begin in September. Now, as mentioned in the beginning, we now open the floor for questions from members of the media. Those of you who are there via social media, that's via the Zoom platform, you would like to indicate by raise of hands. We do see that we have in-house as well. We have Ms. Kalistra Faria. She's here with us. But I believe that Rena has a question, so we go to Rena. Rena, go ahead and pose your question.
Hi, good morning. I hope everybody can hear me.
Yes, everyone can.
All right, so I have two questions at the time you said. So let's start with the renovations of the wards that the minister would have spoken about prior. Can he speak to us as to which wards will be renovated and how soon would we see these renovations starting and alternative arrangements?
All right, I can answer your question, but I'll pass it to the Director of Hospital Services. Let us speak on that subject matter. Thank you.
Thank you for your question, Rena. In regards to the renovation of the wards, we have both medical wards, which both female and medical male, and the surgical wards, both female and medical, female and male surgical wards. So we're in the process of getting the logistics in place, and that should start in the next week or so to get those things addressed. It must be noted that having to do those refurbishment and still have services ongoing, it creates its own challenges, but we have met with the contractors and other stakeholders, and we decide on the path going forward. So I just want to make it known that while we are still providing care, we want to enhance the facilities and where we offer care. I'm not sure you had another question.
No, that's it.
Okay.
Right. So I was asking, as with that, what would happen to the patients? Is it that they're going to be moved to another ward, or is it a situation where they're going to be there while construction is happening?
Okay. So on the surgical ward, the contractor, he decided he will construct whatever he needs to construct out and bring in to the surgical ward to get it done. And the medical contract, the one who has the ward for the medical wards, he wants to block out based on the area. He will block out. So that can be a bit of challenge in terms of capacity for the medical ward, but that's how we are going to go forward. Additionally, we have like a painting and stuff to do. We'll try to minimize that environmental exposure to our patients and use the right paint to suit the environment that we work in.
Rena, does that conclude your two questions?
It kind of does, but I still have to ask regarding that. I mean, does this depend on the severity of the patient's condition?
Can you explain a bit with that question? I'm trying to follow you.
The patients there still while you try to do these reconstruction or renovations. Depending on the patient's health or whatever the condition is, does it mean that they need to be placed in another ward? Because the work is being done, and you would have dust, you would have all sort of elements that can worsen someone's present condition, or maybe even create something that can hinder their health.
Let me try and provide an answer that will probably be as clear as I can. So the director mentioned 4 wards: male and female surgical, male and female medical. Now, what can happen is that the construction work will happen in a phased manner. So you will not tackle all 4 wards one time. That will allow, based on the I guess the type of work that is needed and what products that is used. This will allow patients, for example, on the female medical, if work is ongoing on the female medical, to be housed in the female surgical ward as needed. And the same can apply for male medical. Now, this is not something that is new. You would recall in the very recent past when we had the surge of admissions during the COVID pandemic. We had to make adjustments within the ward, compress certain services to allow for additional space to admit patients. So a similar approach, it's a flexible approach, a similar approach will be employed when the construction work starts on the wards. I hope that answer is clear.
Yes, very clear.
Thank you very much, Rena. Thank you, Dr. Charles and Mrs. Primus Joseph. I now invite Callistra to pose her questions.
Good morning, Callistra Farrier. Picking up from where Rena left off, which by no means is going to impact on my 2 questions that I have to, or how many questions I have to ask. Dr. Charles, you said what can happen, and then you said will happen. So I'd like to know, is there a when is this work supposed to begin? Next week. So is there a detailed plan? Because you're planning to do construction work around sick people. No one gets admitted to the hospital unless they're really sick. So you're planning to do construction around very sick people, but I'm not getting the sense from any of the answers that have been provided that a lot of thought has been put into creating a detailed plan about who goes where, who can't inhale a particular type of paint, or who can't inhale dust, or whose condition can be exacerbated by construction tools working. And you may have that, but what I'm saying is from the two answers that I heard, it doesn't seem that way. So can someone tell me what the detailed plan is for dealing with the patients at the General Hospital during this construction? Thanks.
Thank you, Kalisha, for that question. Just want to state that it's minor construction, not major. So we actually just fixing on some of the cupboards and, painting these areas. So one of the consultants prefer to do build his stuff and come in to install, which is on the surgical ward, where aseptic techniques and those things is critical. So looking at the magnitude of the job is not so much that you would disrupt, we try to minimize it as much as possible. That was done already in the obstetric ward, the same process where we enhance the environment. It was done without major problems. So it's minor, not major construction.
Well, you see, that should have been at the front of your answer, that we're undertaking minor renovations that we do not anticipate will disrupt operations at the hospital. May have been the start. So my questions, if you don't mind. I have one question on plans for continuous maintenance of the the alternative power supply at the General Hospital. I heard about what happened as well. And I would like to ask, was there not a plan for maintaining such a vital service for the hospital? Was there not a plan before? And when you say that plans are in place for, do you mean that a plan has been, there's a plan on paper, a plan of operation on paper for dealing with the generator, or are you planning to look at that?
We'll answer this question in two parts. I'll take the first part, and the rest of it, Prime Minister Joseph, Director of Hospital Services, will respond. Let us be clear that this government inherited the hospital without certain structures, and we are building SOPs, we are building structures, we are organizing ourselves. We cannot do things without properly studying what is there, studying root causes, and understanding cause and effects. So I want to lay this down as a foundation principle on which we operate. And everything we do, we study, we plan, then we execute. As far as the generator and the outages are concerned, we have a backup generator, or we have backup generators on site serving different sections of the hospital. We do have that. Now, we also do have a dedicated line from Gwen Lake, which has been very reliable over the years. Yeah. This time around, we've had maybe about 3 or 4 power outages, 4 power outages, I'm told. Each of them lasting between 10 to 15 minutes, thereabout. And the generator failed to kick in when we expected it to, which means that the automatic transfer switch failed at that point in time. Normally, we would expect it to kick in. Now, usually there would be a month-to-month testing of the generator. But as in everything else, machine goes bad. Right? And that's the reality of life. Now, also, the computer screen failed to function. I guess it lived its useful life. And so what we're trying to do now, what we've done now, is to reinstall the screen. I'm going to stop here and let Ms. Joseph update us on what has been achieved. But I just wanted us to understand that this is where we were, and this is what we are used to, but the system failed. And so we have to take up the pieces, correct it, and move on. So I'll pass on to Prime Minister.
But before you do, I wish we were on the narrative, because I have so many questions from what you just said, Minister. But
I actually feel as if we're on a narrative, because you're narrating and I'm narrating too. But back to Prime Minister.
Just to add, going forward, we ensured that when they fix the control board, whatever design, the asphalt, the as-built design will be done in electronic and also paper-based. We'll ensure that that is placed in the generator room, and ensure maintenance team is properly trained to ensure that we check and document. So we will catch things before it reaches the stage of not knowing. So it's not a lack of, there was no plan in place, nothing like that. It happened, and the generator for sure it's in good working condition. It's just the issue with the ATS, and so that is being corrected now, and we're going to ensure that we have proper maintenance training for the in-house persons, so we can pick up on those things before it reaches to the stage of malfunctioning.
And my next question has to do with hospital records. Now, there's an actual patient in ICU at the hospital. It's a real story. The family, they need to try to coordinate to get assistance for this person. They're trying to get him out because, of course, the hospital here cannot deal with the severity of his injuries. The family was told that they had to wait for 3 business days, and they were told it's like around Friday, so we're looking at like Saturday and Sunday now, part of their waiting time. Can you tell me what the situation is with hospital records? And bear in mind that this example that I gave you has to do with somebody who is currently being treated. Doctors have charts, and it's an open case. How does it work? And why does it take so long? What kind of system do we have for records at the General Hospital that it would take? When it comes to life and death, 3 days is like a really long time. So can you tell me what's going on with the records at the General Hospital?
Thank you for that question, Kalistra. I must say that as recent as Thursday, that's one of the work stream that Mount Sinai is assisting us with. We must be mindful that we do use a paper-based system presently, and look forward to when we get things digitalized. But we are putting SOPs in place. How do you retrieve? How do you release? And in terms of returning those things. So these are things that is actively being done. But yes, it's a challenge with, getting those reports, especially paper-based. But yes, the patient that you're referring to is in the ICU unit, and it's just due process. When you're doing a report, you still want to make sure that you cover all the critical things that patient requires. But we have to fix those processes. But we are in the process of doing those things.
So due process is to 3. Sorry, Sherry. 3 days is your standard time in order for everyone to dot their I's and cross their T's. Is that what you're saying?
All right. So I am hoping that what you are stating is a miscommunication. Even though I do not know the details of the case, I'm hoping that what you are communicating to us this morning is a miscommunication, because I am aware that our staff always, from experience, act expeditiously to assist clients who need to be medically evacuated. That has been the rule. We ensure that the patients are stable and we prepare them, especially if their families are able to organize air ambulance transport and also whatever documentation that is needed. Our staff have been very responsive in ensuring that those are available and ready for transfer. Now, our ministry does not offer air ambulance service out of Grenada. We do not provide that. So that will be entirely dependent on the family or the patient and the insurance or whichever. But I can assure you that every effort is made to facilitate this. So I am hoping that what you are communicating is basically a miscommunication or misunderstanding somewhere.
I mean, I don't know. They were told 3 days. A very kind soul did offer to use their good office to intervene. We won't go into that here because of the wait time that they were given. And this is not about an air ambulance. This is about medical records, not about air ambulance that they weren't able to. And I actually made a post on my social media page about this, and a lady came on and gave a very detailed description of a non-national who ended up dying because she had to wait for weeks to get the medical record. You should go to my page and read her comment. That might help inform how we move forward as well, the experience that she recounted on my page.
My simple answer would be that before concluding, to ensure that all the facts are on the table, I am not discarding anyone's report, but I'm just saying it will be helpful for all of the facts to be on the table before, simply running away with one side.
Commissioner, before you, Minister, go ahead.
Yes, so let me just jump in here quickly. We do have a problem in that people who are not duly authorized to receive a particular patient record will make such request without authorization. These things create delay in delivering records. So we want it to be very clear that first and foremost, patients' records are personal and cannot be given to anybody without proper authorization. And that is critical because we have had situations where people are requesting patients' record who had absolutely no authority to receive those records. So I just wanted to state that for the record. Thanks.
Commissioner, before you go forward with another question, I do want to pose one on behalf of MTV. They're asking for further elaboration on the point that you made as it relates to the increase in HIV. If you have with you any statistics and so as to how the ministry derived that there is an increase in HIV.
I don't recall us saying that there's an increase in HIV, but it was stated that we are integrating HIV care into primary health care. Every year, we generally pick up between 20 and 30 new cases annually. That's new infections. Now, you would obviously I have to bear in mind that these would have to be individuals who may have gotten sick, or they may have had some reason to visit a healthcare provider and get tested and were diagnosed. What that implies is that there are probably more individuals out there who have not had a reason to go in and get checked. They are positive and they don't know it as yet. All right. One of the reasons for integrating HIV services into primary health care is that we want to bring the services closer to people. The current arrangement, a person from St. Patrick has to travel all the way to St. George for certain services. And this is not an equitable way of ensuring that access, for everyone. So we want the services from testing to counseling to treatment now to be integrated as part of our routine clinics. All right, and part of the benefits of that, apart from increasing access, is that you reduce stigma as well, instead of having everyone go to one place and all of that. All right, so that is the that is basically our position.
Let me make a correction because I did make that statement, and so I just want to say that that statement was erroneous. I'm just looking back through my notes here, and I recognize that that is not included on my list of sexually transmitted diseases. So that statement, I wish to withdraw it. With thanks.
Okay, thank you very much, Minister, for that. But I also got a little extra information to share, and they said that the results is based on an improvement in the testing services, and more outreach, and not necessarily in the diseases. So because of the...
What's the source of that information?
The Public Relations Officer, Mr. Frederick.
Right. Let me give you, is this available? Right, so it came, the information, both information, what I said and what Sherian just read, came from within the Epidemiology and Health Information Unit within the Ministry of Health. Right, okay. And forwarded to us by the
The name has left you, Minister. Don't worry,
let me just offer one, this further. Now, as we embark on this integration and we make testing more available and all of these services more available, it will not be unusual for us to come and say, okay, we have X number which is greater than what we had previously, because if you go out there and you do more testing, you may discover more persons who were unaware that were infected. All right, so your statistics will increase. All right, so just bear that in mind when looking at the statistics that we put out annually. Thank you.
Kevin, you wish to make a mention? Go ahead.
Good morning to the panel. I just wanted to really ask a question in relation to the restoration of services on the style just 1 year following Hurricane Beryl. I know importantly that there has been some installation of backup systems with respect to generators likewise, and water storage capacity to ensure that services can be provided. I'm not sure if Ms. Prime or someone else would like to just chime in on that.
All right, so we have renovated 2 additional centers, medical. We have renovated 2 additional medical stations in Carriacou, and of course we restore services at the hospital. We have at those units, we have backup power and backup water supply. And those units are all air conditioned, so it's in a much better working condition. All of those units are climate smart, and hurricane-resistant units. So we have, and we continue to build out those in Carriacou, as well as PT Martinique. The work in PT Martinique has started a couple of weeks ago, and so we are doing the same thing for PT Martinique, upgrading the level of health facility that we had there. So we continue to do that. And we spoke to the X-ray machine that is going to be installed, and the training will happen during the period, I think last week in July into the first week in August. We're going to have training conducted there in Carriacou on the new X-ray unit.
And just as a follow-up, Minister, I gathered that a 10,400 gallon water holding tank was also installed under the G-Cruise project at, I think it's at Leicester Medical Station in Carriacou. Likewise, Happy Hill is also in the list, Kroshu Monjulu, for a 1,000 US gallon high density water storage tank.
Yes, and that G-Cruise project is actually ongoing as we speak. We have, so apart from those facilities that has it, all of those that we upgrading will also have the water storage facility. It's part of our resilience and emergency response system that we're building to ensure that in the event of any natural disaster, we still will be able to have water to service the various medical stations and health centers. So what you'd notice that we're building those tanks stand, and we are housing it. Those tanks are going to be enclosed in a concrete structure, so that in the event of high winds and so, the tanks are not going to be blown away. So we're increasing those that do not have storage. We are installing storage. Those that currently have, we are building the structures around it to protect it from high winds and so on, and we're also increasing the amount of water storage throughout the island of Grenada for all of our medical facilities. Also, generators, we are providing the generator units to those facilities to ensure that in the case of power outage, we can do backup power supply so that the medical services are not interrupted, medications do not get spoiled in the fridge, and those kind of things. Yeah. Sorry.
Kalisha, we'll now take your second round of questions.
Thanks. I must. My phone? Can you tell me whether or not, on the issue of the generator and the plans that you're putting in place to ensure proper operation, is there like a weekly offload testing of the systems, part of the plans that will be implemented?
Yes, that is one of the aspects that will be considered, because that's how we will know that it is actually working. So certain times of the, let's say if it's weekly, we decide to do it. If it's every Thursday at 2 p.m., it should cut off Grand Lake supply and to keep that machine up and going.
So I'm curious, because the minister said at the beginning of his response to this, when I first raised the issue, that he went on to talk about all of the problems that we inherited, which of course is a standard go-to place that we do. But it seems to me that at a major hospital, the systems, the standard operating procedure or whatever for ensuring that you have backup power has to do, was this a lapse in your staff at the hospital? Was this caused because your staff were not doing their jobs? Or was this something that the executive needed to create systems for and failed to do under a previous administration and we hadn't gotten around to it yet? Or what? Because it seems like even if you buy a generator for a hospital, it'll probably tell you these things in the first place. So was somebody not doing their job?
Just before you answer, Minister Kalisha, just kind of get the phone on silent, because it's having a little effect on a little sensitivity in the mic there. So just pull it a little away from it. No, just started. So we just avoid it.
All right. So first and foremost, we're not here really to blame or point fingers, because government is a continuum, and so we respect the efforts that was made under the previous administration. So let me just get this out all the way. The system broke, failed, malfunctioned, and we had to fix and replace. So in the case of the monitor that was spoken of earlier, we replaced the monitor. If the monitor is not functioning, it's like a screen, then you cannot tell what is happening and where the problem is. In order to identify the source of the problem, the monitor must be able to kick in, right? And these things happen from high voltage and what have you. So if power goes once or twice, depends on the age of the equipment, it can easily conk out. So we can't blame anybody for that. The standard operating procedure, as identified by the Director of Hospital Services, is that we do a routine test of the system to ensure that it functions. But even in the face of all of that, based on age of equipment, it still can fail. Right? So we moved rather quickly to troubleshoot, identify where the problem was, and get it fixed. And we want to thank the consultant who worked with us. We also want to thank Grenlec, because they moved really quickly to restore the problem, and they stood with us to find a solution. Now, the hospital power supply is not like any other small business you see around. It's a lot of power that powers up it's a very complex system. Very, very complex. So we have to understand and appreciate all of these things. A few months ago, in January, management took a decision to carry out an electrical audit of the system. So we have identified where all of the gaps are as far as our electricity shortcomings, failures, or potential failures are concerned. So we have that report, and we've started the process of correcting anything that might be amiss. So we've fixed quite a lot, and we continue to work. Now, and we must understand and appreciate also that all of this will always be a work in progress. The hospital is a very dynamic environment. Yeah, patient comes, they check in today, they leave tomorrow, or might spend 2 days, or some might spend a month. So sometimes, based on occupancy levels, you can or cannot do something. Based on if somebody's in ICU or any of the other units, it could create little challenges for us. So all of these things have to be weighed carefully when we are making changes at the hospital. Yeah.
So I have only 2 questions.
Sorry, okay. But I thank everybody else. I thank Grenlec, I thank the consultant. I now must thank the staff, the maintenance staff, and the administrative staff at the hospital for responding. The nurses who put on the phone lights to fish through the ward during that period of outage. We want to thank all of them, our nurses, our doctors, and our patients who were tolerant with us during the time of outage at the hospital. Thank you.
Thank you for your indulgence, Sherry. I just have one question. I'm not sure if the issue of health insurance was addressed before I came in. So did you provide a timeline for what we need to do for health insurance? You provided that? Okay, so I'll go back and listen, and then I'll call you with the questions I have on that then. Minister, CMO, Director, people keep messaging me or meeting me and saying to me, there's no medication at the hospital. It doesn't make sense to me when I hear people say that. Could someone tell me what's going on with medication at the hospital and why some people have the perception or the belief that we don't?
So I do know that is a topical question. So the health system has a formulary which is a list of all of the drugs that we procure to treat patients. This list was recently revised in 2024. This list then goes to our main supplier, which is the OECS PPS, with the quantities to be procured. Now, there are instances where maybe as a result of supply chain challenges or so, that stockouts may occur. This was more prevalent in the past, but most recently, with the changes that we've made at our central medical stores, improving the human resource and the processes there to address this issue. This is less of an issue. However, there are some drugs that are not part of the formulary. There are some drugs that are not part of the formulary. There may be newer drugs, or there may be drugs that, because of their cost, it is simply not feasible for us to procure these drugs. All right? When patients are placed on these drugs, they are asked to purchase them privately. All right? So these are the instances where you may hear that there is no drug. But obviously, it's an entire health system that operates both hospitals and communities, and obviously it cannot operate without medicines. But of course, there are times when some medicines, they're either not available due to stockouts, or we simply do not carry them.
Sorry, I'll have to cut you because we do have to wrap the conference to make way for another conference.
Okay, I know, but it's just a follow-up. Are we seeking to close those gaps? Because I know that you're reviewing and you're looking at a lot of things. That sounds like a serious gap to have. Have you been able to identify what, like the short outs, for instance, and how you would try to get around that?
So yes, as it relates to the stockouts, yes, we have made significant strides in addressing them. But there's one element that I mentioned in when I started. There's one element that is outstanding. We really need to upgrade our inventory management system. All right, that will significantly allow us to more efficiently manage our stocks. However, as it relates to the drugs that we do not carry, now remember I said in November of 2024 we updated our formulary. All right, which is a process that involved all of the different specialty areas in both hospital and primary health care. All right, and we came to an agreement on all of the drugs, all right, newer, older, all right, what needs to be taken off, what needs to be added, all right, and that was finally approved. However, there are some drugs, as I told you, that because of their cost, it's simply not feasible for us to procure them, at least not at this time. All right, and in those instances, yes, patients are asked to make arrangements if that is the only option to purchase them.
Thank you very much, Dr. Charles. I know that we do have to end to clear for another conference, but we will just allow one final question from Rena, who is joining us via the Zoom platform. Rena Pierre-Thomas, go ahead with your final question.
Thank you very much, Sherry. I just wanted to speak to the regularization of workers and statutorization of the hospital. Where are you when it comes to competition with the union of the to agree with the statutorization or to work along with you? First have to talk about regularization of workers. Where are you with that and the package, the work package that would come along with it? I'm talking about salaries and other adjustments.
Yes, so the process is ongoing. On the 23rd, which is about 9 or so days from now, there is going to be a retreat to look at the whole body of work that is going to be undertaken. So it's an ongoing process, but I can say the regularization is happening. It's happening. The Department of Public Administration, alongside the senior administrative officer within the Ministry of Health with responsibility for human resource in health, they are working together alongside other senior management to make this happen. So the regularization part is happening. The statutorization is also happening. There are a lot of other things that embodies statutorization that is being considered, and we'll have a number of presentations from within the structure of the hospital and health that will be considered during the retreat as they continue to plan and execute their work. So it will take some time, as I said earlier, but it's a process. Thank you.
Thank you very much. Viewers, this is where we're going to wrap this conference, but before we do, I'm just going to take some final words, beginning with Dr. Sean Charles.
I guess I'll start by my final words would be where I started. I believe that the most important thing that the public should pay attention to is what happens before you engage the health system. All right, we should look at the things around us, what we call the risk factors for diseases, for injuries, and ensure that we prevent them. All right, so that we do not fall sick and need to be maybe admitted to hospital or otherwise. So that would be my encouragement to the public. Get screened. I know Carnival is just around the corner. Many persons take the opportunity to indulge, especially in alcohol, and we do not eat properly. We consume heavily salt foods with a lot of salt, and it's a lot of risk factors for health issues that come up afterwards. So I encourage all to pay attention to your health. Your health is your most valuable asset, and if you do not take care of your body now, it will not be with you for very long. Thank you.
We now move to Mrs. Maria Primus-Joseph, the Director of Hospital Services, for her final points.
I want to piggyback on CMO's utterances. We must take a proactive approach to how we treat health and our bodies. And I just want to re-emphasize that hospital services are making necessary changes to ensure that patient experience is enhanced, and we are committed to offer the best possible service that our patients deserve. And thanks.
And the final word is yours, Minister.
Thank you, Sharian. I think this is the first time in a very long time within the state of Grenada, so much is happening within the Ministry of Health. We have the upgrading of our primary healthcare facilities throughout the length and breadth of the country, which will happen, which has begun and will last for another 18 or so months. That is a massive undertaking. I think we have about 21 of those facilities down for upgrades. Alongside that, we have the statutorization of the hospital, national health insurance under consideration, the Mount Sinai engagement, the construction of the new hospital via the Project Polaris outfit. And we're also looking at the incentive packages for doctors and nurses and other professionals within the system. Just so much is happening at one time. I think we are privileged to be able to to witness this in this time of history. And I call upon the population to be patient, because health is something that must be properly considered before we make any changes. We must study properly, we must plan properly, and we must execute in a very diligent way. So it is important that we are together on this one. This one, I believe, supersedes politics. It goes beyond our own wishes and likes and comfort zones. It goes deep into the fabric of what we need and who we should be as a Grenadian people as we shape our country. Healthcare is important. If we do not have health, we cannot acquire wealth. As a matter of fact, we'll give everything for just to be alive and to experience good health. So it is important that we make these changes. Some of it is going to be uncomfortable, as Dr. Charles intimated earlier. So I call upon the population to be patient and to work with us as we continue to work to transform healthcare in Grenada. Thank you very much.
Thank you very much, Minister. And viewers, we thank you for joining us. We heard it from the Honorable Philip Telesford, the Minister for Health. We had Dr. Sean Charles, the Chief Medical Officer, and Mrs. Maria Joseph, Director of Hospital Services. And together they gave you a thorough overview of the issues within the Ministry of Health and how they are addressing them, plans and programs and projects to come on stream, those that are already ongoing as to what status they are at, and some of the new initiatives. So on behalf of the entire team here, I want to thank you very much for joining us, and I'd also like to remind you that coming up shortly after this press conference, we would have another press conference, and this time it would be with members from the Grenada Cultural Foundation as they speak to activities for Emancipation Day 2025. So once again, thank you very much to the media practitioners that joined us and those of you who are viewing online. I am Sherry Noel. Thank you for viewing.